The hand is the region of the upper limb distal to the wrist joint. It is subdivided into 3 parts: the wrist or the carpus, the metacarpus, and the digits, 5 fingers including the thumb. If we look at the most proximal part of the hand, we have the wrist or the wrist joint. The proximal row of the carpal bones, articulate with the radius forming the radiocarpal joint. The ulna is not part of the wrist joint. It articulates with the radius, just proximal to the wrist joint, at the distal radioulnar joint. It is prevented from articulating with the carpal bones by a fibrocartilaginous ligament called the articular disc, which lies over the superior surface of the ulna. The 4 carpal bones in the distal row articulate with the bases of the 5 metacarpal bones, forming the carpometacarpal joints. The joint is enclosed in a capsule and synovial membrane. The stability of the wrist is provided by ligaments. One of the most important ligament is on the palmar aspect called the flexor retinaculum, which together with the carpal bones forms a canal, the carpal tunnel. The carpal bones that are involved in the making of this tunnel are pisiform, triquetrum, hamate, capitate, trapezoid, and trapezium. These bones combine and form a structure called carpal arch. The flexor retinaculum passed over this carpal arch, leading to the formation of carpal, tongue through which nerves, muscles and blood vessels run through. It is this area that is involved in carpal tunnel syndrome. On the dorsal surface we have the extensor retinaculum. The following movements are possible at wrist: flexion, extension, abduction, adduction, and circumduction. Rotation is not possible because the articular surfaces are ellipsoid-shaped. The movements of pronation and supination of the forearm compensate for the lack of rotation. Moving on to the next part of the hand, that is the metacarpus. The metacarpus comprises of 5 metacarpal bones. These bones make up the palmaria of the hand and the form joint with the distal row of the carpal bones, the carpometacarpal joint and the metacarpophalangeal joint. As for the digits, the fingers and thumb are called the digits of the hand. The 5 digits consist of the laterally positioned thumb and, medial to the thumb, the 4 fingers, the index, middle, ring, and little fingers. For convenience, these digits are also numbered by the anatomists as them being digit 1 or D1, and the rest of the digits given the subsequent number of D2, D3, D4, and D5. In the normal resting position, the fingers form a flexed arcade, with the little finger flexed most and the index finger flexed least. In the anatomical position, the fingers are extended. Abduction and adduction of the fingers are defined with respect to the long axis of the middle finger. In the anatomical position, the long axis of the thumb is rotated 90 degrees to the rest of the digits, so that the pad of the thumb points medially. Consequently, movements of the thumb are defined at right angles to the movements of the other digits of the hand. This is what the hand looks like in a normal relaxed position. Let's go on and talk a little bit about the hand's skin and fascia now. The hand is a mechanical and sensory tool. Many of the features of the upper limb are designed to facilitate positioning the hand in space. The skin of the palm is thick for protection of underlying tissues, creased, and immobile because of its firm attachment to the underlying palmar aponeurosis, part of the deep fascia. All these characters increase the efficiency of the grip. The skin is supplied by spinal nerves C6, C8 through the median and ulnar nerves. Radial nerve supply is also present in the hand, as the nerve is responsible for motor innervation of extrinsic muscles of the hand. If we talk about the fascia, we have the superficial and the deep fascia. The superficial fascia of the palm is made up of dense fibrous bands which bind the skin to the deep fascia, or the palmar aponeurosis, and divide the subcutaneous fat into small tight compartments which serve as water cushions during firm gripping. The fascia contains a subcutaneous muscle, the palmaris brevis, which helps in improving the grip by steadying the skin on the ulnar side of the hand. The superficial metacarpal ligament, which stretches across the roots of the fingers over the digital vessels and nerves, is a part of this fascia. If we look at the palmaris brevis, the palmaris brevis is a small thin muscle found superficially in the subcutaneous tissue of the hypothenar eminence. It is an intrinsic muscle of the hand, as it originated from the palmar aponeurosis and flexor retinaculum. It attaches to the dermis of the skin on the medial margin of the hand. Hence, it is considered to be part of the superficial fascia. As for its actions, it wrinkles the skin of the hypothenar eminence and deepens the curvature of the hand, improving grip. It is innervated by the ulnar nerve. If we look at the deep fascia of the hand, the deep fascia is specialized to form the flexor retinaculum at the wrist, the palmar aponeurosis in the palm, the fibrous flexor sheaths in the fingers. All three form a continuous structure which holds the tendons in position and thus increase the efficiency of the grip. Let's talk about these structures in detail one by one. Starting with flexor retinaculum. As mentioned before when we talked about the wrist, flexor retinaculum is a strong fibrous band which bridges the anterior concavity of the carpus and converts it into a tunnel, the carpal tunnel. If we look at the attachments, it is medially attached to the pisiform bone and the hook of the hamate, and laterally to the tubercle of the scaphoid and the crest of the trapezium. If we look at the cross-section view of the wrist, on either side, the retinaculum has a slip. The lateral deep slip is attached to the medial lip of the groove on the trapezium, which is thus converted into a tunnel for the tendon of the flexor carpi radialis. The medial superficial slip, or the volar carpal ligament, is also attached to the pisiform bone. The ulnar vessels and nerves pass deep to this slip. So, the relations of the flexor retinaculum are divided as superficial and deep structures. The structures passing superficial to the flexor retinaculum are the palmar cutaneous branch of the median nerve, the tendon of the palmaris longus, the palmar cutaneous branch of the ulnar nerve, the ulnar vessels, the ulnar nerve, and the thenar and hypothenar muscles arise from the retinaculum. You can remember structures passing superficial flexor retinaculum with the help of a mnemonic. Umbrella protects me from tan skin. Where umbrella is associated with the ulnar nerve and artery, P and M in protects and me are capitalized to memorize the palmar cutaneous branched up the ulnar and median nerve of the hand. The T and S in tan skin is for tendon of palmaris longus. As for the structures passing deep to the flexor retinaculum, they are the median nerve, 4 tendons of the flexor digitorum superficialis, 4 tendons of the flexor digitorum profundus, the tendon of the flexor pollicis longus, the ulnar bursa. The tendon of the flexor carpi radialis lies between the retinaculum and its deep slip in the groove on the trapezium. Lastly, the tendon of flexor pollicis longus and radial bursa also lie deep to flexor retinaculum. In this much simpler schematic diagram, you can see the relation of flexor retinaculum with the ulnar artery and nerve, as well as the palmar cutaneous branch of the median nerve. The tendon of palmaris longus is also shown here. A mnemonic to remember the deep structure to the flexor retinaculum is special-purpose machine is full of bugs. Here the capitalized words are linked with the following structures: flexor digitorum superficialis tendon, flexor digitorum profundus tendon, median nerve, flexor pollicis longus, radial bursa and ulnar bursa. Next, we have the palmar aponeurosis. This term is often used for the entire deep fascia of the palm. However, it is better to restrict this term to the central part of the deep fascia of the palm, as shown here. Palmar aponeurosis is a triangular condensation of deep fascia that covers the palm and is anchored to the skin in distal regions. The apex of the triangle is continuous with the palmaris longus tendon when present, otherwise it is anchored to the flexor retinaculum. From this point, the longitudinal fibers radiate to extensions at the bases of the digits that project into each of the index, middle, ring, and little fingers, and to a lesser extent the thumb. Transverse fibers interconnect the more longitudinally arranged bundles that continue into the digits. Vessels, nerves, and long flexor tendons lie deep in the palmar aponeurosis in the palm. Palmar aponeurosis fixes the skin of the palm and thus improves the grip. It also protects the underlying tendons, vessels, and nerves. Lastly, we have the fibrous flexor sheaths of the fingers. The fibrous flexor sheaths make up the deep fascia of the fingers. The fascia is thick and arched. It is attached to the sides of the phalanges and across the base of the distal phalanx. Proximally, it is continuous with a slip of the palmar aponeurosis. In this way, a blind osteofascial tunnel is formed which contains the long flexor tendons enclosed in the digital synovial sheath. The sheath holds the tendons in position during the flexion of the digits. The fibrous sheath is thick opposite the phalanges and thin opposite the joints to permit flexion. That is all about the wrist and the fascia of the hand. Stay tuned to learn about the intrinsic muscles of the hand.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.